Hi, welcome everyone. My name is Susan Reyna, and I'm here today with Marie Grimberg. We represent Beacon Therapeutic Diagnostic and Treatment Center. This is a live call-in show, so for the next 30 minutes, you'll hear us talking, unless you call. And the number is 312-738-1060. I'd like to put up Beacon's mission statement. We're empowering children and families by helping them find their way to a better future through the provision of accredited educational, mental health, and social services. These are our 4 different locations. We have our business office on 103rd. We have our homeless outreach services on Western Avenue. We have our high school in Calumet Park. And at our Longwood campus, we have our elementary school and our outpatient clinic. Beacon is a multi-service organization that's been around since 1968. We offer a myriad of services really targeting children and complex family needs throughout the city of Chicago. We did start off as a school, and since then we've really branched into early Head Start, homeless services, therapeutic day services, and intensive outpatient programming. I'm here today with Marie Grimberg from Heartland Health Outreach, and Marie is part of our FACT team, which is our newest program, which we're quite excited about. And so, Marie, before we start talking about FACT per se, tell us a little bit about yourself and your background.
Sure, and thank you, Susan, for having me today. It's great to be here. I'm a big supporter and fan of Beacon. So kind of what brought me to Heartland Health Outreach, my background is in special education, both my undergrad and master's degree, and sort of spent some time out in the Pacific Northwest after college, volunteering through a post-grad volunteer program with an organization that did street outreach and provided experiential learning opportunities for folks to educate them on homelessness. And it was sort of through that opportunity that I really sort of began to sort of fall in love with, the issue of homelessness, and kind of really became passionate about, wanting to end it and look at sort of the systemic causes. So, continued to pursue my degree in education, and then sort of thought, all the issues that these kids were bringing into the classroom, outside of just learning, that really did impact their learning, such as their housing status, nutrition, exercise, things like that. I decided those issues were perhaps of a bit more interest to me at this time. So, started working with another social service here in Chicago, doing community development work. And a bit of community organizing work as well. And then this opportunity came through Heartland Health Outreach and Beacon Therapeutic to work on this national initiative, working with young single homeless mothers with young children, where we developed a service model to work with this very specific, unique, and very vulnerable population. And we also were able to attach a systems level person, someone that's looking at sort of all the different systems that affect homeless families. And so that's what I was brought on to do. And we've been at it a little over 3 years, and I think we're really proud of the systems and service outcomes that I think we have to show for it. So it's great to be here to chat about it.
Yeah, I think, goodness, you said so much there. And I think it's, which is great, because I think it really conceptualizes everything that we've been doing with the FACT project. And I think some of the real unique features of the FACT project is you mentioned you're from Heartland, we're from Beacon, and one of the most unique features is that clearly it was a collaboration. And so I'm going to talk a little bit about some of the services of FACT.
Sure.
And then maybe we can talk about some of our partners.
Great.
So we had Heartland, and I know Heartland is a larger organization, so there was 2 components to Heartland. Can you describe?
Sure. So Heartland Alliance for Human Needs and Human Rights is the organization, the umbrella organization under which there are 4 separate nonprofits, and 2 of those, Heartland Human Care Services and Heartland Health Outreach, are the ones that have been dedicated to working on this project. So we've been able to provide some housing, some case management, and then also the systems work that I've been providing. So.
And then I know some of our other partners, we were able to secure University of Illinois to be our evaluation partner. We had Voices for Illinois Children, who's helped inform some of the policy type broader issues. And then we've had other partners along the way, over the past 3 years. So we worked with Thresholds, we worked with Goldie's Place, Inner Voice. And clearly the mandate was that it was a national request from the Hilton Foundation to identify a collaboration that was going to specifically target young mothers. And I'm going to put the criteria up for the initiative. in terms of it being young mothers ages 18 to 25. They must have at least one child under the age of 5 or 5 or under. They need to be homeless or at risk of homelessness. They have to have a diagnosis of serious mental illness, substance use, or have been victims of domestic violence. They also, ideally, the population, because it is a very service-rich model, having some DCFS or child welfare background, and also representing limited supports. I think the real key feature to this is this whole systems piece. And clearly, we walked into this. Beacon as the lead on the initiative, and we walked into it with the service model in mind. But the unique feature was the systems work, and that's been your expertise. So tell me exactly, I know initially the center was calling it boundary spanners.
Right.
And something Heartland has really developed a niche in terms of systems integration. What is systems integration?
Yeah, so Heartland's been working on this concept of systems integration since about the mid-90s, essentially where we're looking at sort of the different systems that affect a particular population, in this case homeless families, and trying to identify the gaps and the barriers that surround that population in terms of access of those systems and kind of all the different resources that they provide. So, for example, with FACT and looking at families, homeless families, we're looking at the child welfare system. We're looking at child care, Head Start, education, early intervention, healthcare, those sorts of things. And so it's trying to figure out sort of who are all these different systems that are frankly serving often, unfortunately, the same population, and kind of trying to build those collaborations and relationships so that we can sort of break down those barriers and fill those gaps so that it's more seamless service delivery across all the systems that are affecting a population. So I think Heartland Health Outreach was really excited to be a part of this initiative with Beacon, because the systems integration work that we've done thus far has been around single adults with mental illness and co-occurring substance use. Just has been a priority population for us for a long time, and this really gave us the opportunity to sort of look at what are the different systems that affect homeless families, and it's been a terrific opportunity for us to sort of build our capacity to work with homeless families and sort of look at those different systems. And so I think it's been such a terrific collaboration that we've really been able to give and take from each other.
I think it represents probably the best way to do work in the social service arena now is recognizing where the skill sets that everybody has. And I think that was so wonderful about this initiative, is it recognizing, yes, Beacon has been working with homeless families for many, many years. Heartland has these direct expertise with the systems integration, because it really is an art. So how is your SI work, your systems integration work informed?
So I kind of organize the work around various strategies and just ones that we've sort of come up with over the years, and kind of what works and how do you get the work done, because I think people get really overwhelmed with systems change. I think often we sort of tack it on to the work that you're already doing. So case manager, try and figure out why your client can't access public benefits. Figure that out. Well, when they have folks sort of right in front of them with these immediate needs, that goes to the bottom of the list. And so first and foremost, kind of we really strongly believe that you dedicate staff to this. So this is my full-time job. I'm not adding this to anything else. I'm not delivering direct services. Frankly, this is my full-time job. So that's a really key component to this. So 100% of my time is spent on this. We're also really looking at coalition building. So in this case of FACT, looking at the different systems that affect homeless families. And for us, we were able to use this concept of a planning coalition, which was our vehicle to sort of make systems change. And so we did as with all of the FACT partners, we developed kind of a list of sort of who do we think are the stakeholders, the leaders in the systems that affect homeless families that we need to be at the table. So sort of through that process did a citywide needs assessment to figure out kind of what are the priorities, and so then from there sort of planned our work. We also look at another strategy we use is cross-training. So taking the different systems that affect a particular population and literally cross-train each other on the different, kind of how do you access this system? What are the resources that I could be accessing? Who's eligible? Things like that. I mean, this is basic stuff, but people just aren't sort of given the tools and don't have the time to sort of figure that out and navigate it themselves.
I know we have a caller, and I want to get back to some of that, because I think,
Sure.
There's been some exciting connections that have been made that have really benefited the participants. Caller?
Hi, this sounds like a fabulous partnership. And have you got to the point where you have any outcomes from this new program?
Yes, actually we do. Great question. A couple of things. I mentioned our evaluation partner earlier on, University of Illinois. And because this is part of a national program, there is a national evaluation that's also coming. We're waiting for results from there. But what we were able to find are some key things that really make an impact on homeless families. There's some systems outcomes that you can talk about, but I'll talk about some of the service outcomes. What we found is that over the course of the work of the families with us, the amount of parental stress has gone down, and that's based on an objective assessment of parental stress index, an assessment tool that was used. We also found that the children's development has either remained on track or has improved. And based on what we know about children, homeless children in particular, and the impact of homelessness on them, we know that most of the time when children are homeless, they do show developmental delays. So the fact that these kids that we worked with were either on track or were able to recoup any delays is significant. We've also found that the rate of suicide and the mothers, prior to them, there was incidents of suicide. Since coming to us, they haven't, which is significant. Also, we've seen a reduction in pregnancies. Again, with this young population, that's something that when we looked at the spacing of the births of the children prior to coming with us and then coming with us, that was a better indicator. And I know there's some specific systems outcomes that have been shown. Can you talk a little bit about those?
Sure. So we just mentioned this planning coalition that we've developed, and I think something we're most proud of is that over, now that we've been in existence over 3 years, we still have over 40 entities that have dedicated their time and resources to participating in this and being active members. And again, these are high-level folks that we're not paying to be involved, and they're sort of taking the time to be not just sort of show up at these meetings, but do the work, because I don't work for the child welfare system or the child care system. So it's really having those champions in those systems that's really made this work. So I think that's something we're very proud of. And speaking of the child welfare system, I think we've just made some tremendous strides in building that collaboration and really helping the system see that, we are seeing a lot of the same families. Many families, unfortunately, are exiting the system into homelessness. And so really, and I think they've been very open and honest about having that conversation with us. And sort of one tool we've been able to create very simply, we were finding that folks were coming to us, in fact, with virtually no documentation in terms of, a social security card, their state ID, medical records. And so we just kind of asked the system, how do we sort of make this, what can we do here to make this not happen? Because once people are exiting the child welfare system, they're no longer, they don't really have as much access to the system, of course. I mean, they're dealing with lots of folks with greater needs, and, once they're gone, it's hopefully a success and they move forward. And so we created just a very simple document that sort of helps caseworkers go through this very brief checklist that just says, okay, do you have X, Y, and Z before you go? And now that has been put in place as part of the statewide policy and procedures for the Department of Children and Family Services. Very simple.
And that's so big. I mean, yes, it's very simple, but it's very big. And I think when we're talking about youth who are exiting, they're aging out.
Right.
So they're 21. They've been in the system perhaps who knows how long, and so they're exiting with the child of their own, and suddenly they're on their own. And so what we found, and it's this interesting data, that over, I think, approximately 47% of the moms that we've worked with are moms who have been in DCFS care prior to.
Right.
So something as simple as that can really give a young mom, an opportunity to make things a little bit smoother.
Right. And, get access to employment and housing. I mean, you're not going to get those without identification, for example, or to ensure a continuity of care with their doctor, psychiatrist. You need those medical records so that they can sort of, like you said, have seamless service delivery.
See, and that's a simple thing, but it's something that I think with families, there's so many systems that come to play when you talk about children's services, mother services, family services, mental health, substance use. There's so many resources that have to be tapped in. What are some of the other systems that have been impacted by the FACT work?
I think what I'm thinking of right now is the early intervention system. So essentially, children from 0 to 3 are eligible to receive developmental screening for free, and then if they're sort of deemed eligible, they can receive developmental therapies up until the age of 3. And homeless children are one of the priority populations and are vastly under-enrolled in that system. And so we've done a tremendous amount of work, again, trying to show folks, we are seeing the same families. And frankly, the homeless system has not been accessing the system, the early intervention system, in the way that they could and should. And I think a lot of it's just education, didn't even know it existed. We were able to hold a citywide cross training last year with over 100 attendees, and I can't tell you the number of folks who said I didn't even know this was an option, and that it's free and it's completely accessible. They're all over. There's offices all across the city that folks can access pretty easily, and folks will come out to your home or your shelter or wherever you're staying and provide those services for you. So right now, actually, we're in the process of piloting kind of what would it look like to really develop an infrastructure and process within the shelters to provide early intervention services on site, and again create that seamless service delivery and referral process. So hopefully sometime next year you can have me back and we can talk about those results.
That's right. Good stuff. Actually, we have a caller. I want to go back to that.
Oh,
we have
great.
a caller. Caller? Yeah. Is there a question?
I was wondering, how can the community help you to sustain this program?
Good question.
Great.
Sustainability is a question that we struggle with. I think most non-for-profits are struggling, but I think particularly the FACT project is one that received dedicated funding from some key local funders, Polk Brothers, McCormick Foundation, as well as our national funder, the Hilton Foundation. But their official funding ended June 30th. And so right now we've been able to secure city funding, and then some of our same funders are still there. But, in terms of funding, we are looking to, DCFS, we're looking to the city. How can the funding continue? But also we have fundraisers. We accept donations, of course. But I think, particularly we're having a large FACT forum November 1st. And the intent of that forum is to really make the broader community aware of how valuable this initiative is, and what will the system look like without this initiative if it doesn't continue to get funding, and the significant impact. And so we're trying to inform as many folks as possible about the value of the work. We're also trying to strategically be in line with the different things that are going on within the homeless arena. Particularly, there's an evaluation of the Plan 10 homelessness, and that's something that, what are the gaps within that system, and how does the work that we've been doing, how does that get influenced? The evaluation data that we have from this is also influencing the development of some national tools. There's a family vulnerability index that's being implemented, or it's being defined at this point. And so our data is helping influence that. And again, the intent is for the community at large to see the value is for funders, for legislators, for different key stakeholders to recognize the importance of it, and then obviously hopefully funding will come along with it as well. But this is something that there isn't, if anybody can access a service, we don't turn anybody away, there isn't a fee for this program. That we do bill Medicaid if Medicaid is available, but sometimes it's not available as well. And also, we do accept, these are very needy families, so that's something I'll talk at the very end, a fundraiser that's coming up, but also in terms of the community making donations in terms of items. We have Fresh Start kits, we set up our families with housing, so we're always looking for those kinds of donations as well. And Marie, I wanted to go back briefly to the training that you were talking about, and the pilot project. What are some specific things? Because I attended the training, and I know it was intriguing to see all the homeless providers there and all the EI providers there. And what do you think some of the secondary benefits of that has been?
Yeah, it's a good question. I think putting a face to the name for so many folks and really understanding, like, literally, how do I access this and where do I go? You've given me this, general referral line. Well, I want to know who I'm talking to on the other end. So I think that's been a huge benefit. And also really sort of breaking down the stereotypes of what folks think the other system is doing or not doing, and really helping folks understand what does a homeless family look like, what will a shelter look like when you walk in, or we know that in our work with homeless families, many are living in doubled up situations, so they're not in shelter, they're not outside, they're not in their car, they're couch surfing or living with another family or friends for a while. So trying to help people understand kind of what they're walking into, because we found through that training and sort of other technical assistance we've been asked to provide, that folks know that they're out there but just don't know where to find them, and kind of don't know what to expect. And I certainly understand that if you're not familiar with the system, how would you know? But I think really helping folks understand that this is a priority population. I mean, they are a priority. They're eligible just based on kind of who they are, because often, specifically with FACT, these are young families. So the mom's a teen parent.
I'm going to put some pictures of some of our participants on.
Oh,
I
great.
think that always kind of brings it home in terms of who we're talking about. So, tell me, have there been some specific systems that you found harder to pursue, but now that are right in there?
Gosh, I think, at the beginning it was, you definitely have to sell it at first, kind of helping folks, just having those sort of one-on-one meetings and follow-up calls to talk to folks about sort of what is the connection between us and them. And so I think so that was a struggle at first. But I think, once we were sort of able to get folks to the table, come to these coalition meetings, which happen quarterly, really being mindful of what works for them and a location that works for them, bringing sort of their colleagues to the table has really been beneficial. So, I'll just say, I think some of the sort of the biggest systems that I think we've really built strong relationships with is the early intervention system, the child care system, Head Start, and the child welfare system, and obviously housing, have just really been tremendous partners of ours. And I think, often people think these are such huge systems, I don't know how to navigate it. And it was just building those relationships, finding those champions, and all those systems certainly have them, that has really sort of made us very successful, and I think them as well. There's a reason people are sticking around 3 years later, I think. And so it's kind of what makes it worth trying to figure out what makes it worth their while and what's in it for them.
One of the things that I know, Beacons Project was one of 4 initiatives nationally. There was 2 in California, 1 in Minnesota, and then 1 here in Chicago. And I know we're the ones that had a dedicated systems integration manager, which really made a difference in terms of, and how I saw it was really there was a service piece, but the systems piece was designed to make the changes last. And so I think, clearly the service work is going to continue, but the changes that have been made through the SI work really are long lasting at this point.
Right.
And I know that you've presented nationally and locally on what we've been doing here, and particularly the systems work, because that's something that's growing in interest nationally.
Right. And I think, we know kind of what our economy looks like right now. We're about to engage in healthcare reform, or we are engaging in healthcare reform. And I think we do as a system and as a country really need to start looking at system level changes, and that we can't just continue to put Band-Aids on situations and people's lives. We need to sort of look at what's the root of these problems. It's cost effective, it's cost efficient, and it's our reality, because these problems are getting to be so huge that we can't just continue to do business as usual. And it's a tough sell. I understand that you're asking people to invest in systems level change. Well, that takes a lot longer. And so it's not asking folks sort of support us for a year and let's see what we can do. It's really, this has been such a benefit of being a part of this national initiative that we were really able to take 3 years and sort of see what we can do with this. And I think, we were able to just survey our coalition members recently and said kind of what's been the best part of this final year. And the majority of folks said we were able to see all this hard work come to fruition. And so, again, a need for continued funding, that a lot of things finally have sort of happened. Certainly small wins along the way, but some of the biggies have happened just in this last year. And sort of now we have this synergy and energy, and we need to continue to build upon it, because sort of once you fall off, it's hard to build it back up again. And so they're just sort of speaking to the need of continuing to sort of fund this kind of work. And I think another benefit of being part of this national initiative is because we have some terrific private funders, both at the national and local level. We've really been able to show them kind of why this is worth their while, and they get a lot of bang for their buck. And so I think they're just really terrific advocates for us as well, that they kind of really see why this is so important. So I think we're lucky to have them support us.
Yeah, I think that's what sets Chicago apart, is that we really have some strong proponents for around needs of family homelessness. And I think particularly Chicago really has continually stepped ahead of the game and recognizing that this is a desperately needy population that really needs proper resources. And so, yeah, we're very fortunate for that. I know next week, we're running out of time. Next week, we're going to have one of our participants from the FACT Project come on the show, which we're really excited about, because I think that'll be profound to be able to hear from her. I think the stories of some of our moms are just overwhelming, but the degree of resilience and strength that these moms show and their willingness to do whatever they need to do for their children are phenomenal. I'm also going to put up, as we wrap up, a final slide on our event. It's coming up. It's coming up December 2nd from 6:30 to 10:30, and it's an event where 100% of the proceeds do benefit our shelter outreach services. Peggy Rourke's information is on there. She's our development director. You can call 773-298-1243, or you can reach her at prourke@beacontherapeutic.org. Thank you very much, Anne-Marie, for joining us today. It was a lot of fun.
My pleasure.
We didn't crack up too much, I don't think. And we got a few phone calls. So see everyone next week, and thanks again, Anne-Marie.
Have a good evening.
Okay, bye.